Hi, this is Mrs. Lewicki, and this is part 2 of 3 voiceover PowerPoints on delegation. So one of the things that we struggle with when we're trying to decide about delegation is it delegation or is it assignment? So we look at scope of practice, and in the previous slide presentation, we talked about the delegating things that are within the UAP's scope of practice, but that maybe be outside of their normal assignment duties. So delegation, what happens in delegation is you're transferring responsibility and authority of that, where in assignment, there's no transfer of authority. It reflects job description, patient needs, and organizational needs. So while in nursing school, we teach you how to take vital signs and how to make beds and how to give baths, generally speaking, the duties or the assignment of those tasks belong to the UAP or the patient care tech. And so that's an organizational need. Now, delegation versus dumping. So when you are looking at delegating tasks, you want to do that because it makes better use of time and your resources that are available to you. You don't delegate to dump undesirable tasks or transfer work to a productive employee. What does that mean is that it might be better use of time for the patient care tech to assist somebody to the bathroom, but if you never assist somebody to the bathroom or they're overwhelmed with work, but you see it as their job and not yours, that's what it means by dumping that task. Nurses need to maintain perspective on what task nurse can achieve in timely fashion and what tasks could be performed effectively by a delegate. And delegation should always be done in a way that provides greatest benefit to the patient, makes best use of time of all staff members, and provides delegates with opportunity for growth. The benefits of delegation to the nurse: it's more time for tasks that cannot be delegated, such as complex patient care, assessments, complex dressings, things that require the nurse's attention. It increases nurses' job satisfaction, and it improves the organization's employee retention rate. Benefits to the delegate: allows delegates to gain new skills, abilities that can help them advance in the organization and therefore their career. Enhances job satisfaction. Motivation as delegate is stimulated by new challenges. If you recognize that a UAP can do a task that maybe is previously been done by nurses, that actually helps them to enhance their job satisfaction. Delegates feel more appreciated and appreciate others' roles and responsibilities, and internal satisfaction from knowing they contributed to achievement of desired patient outcomes. Benefits to the manager is appropriate delegation means that the whole place runs better, the unit functions better. Manager can devote more time to management functions that cannot be delegated. And with additional time gained, managers have increased opportunity to develop new skills, abilities that facilitate career advancement. And benefits to the organization is that the goals are achieved more efficiently, improvements in quality care, patient satisfaction, productivity increases, and financial position may improve. The delegation process: nurses delegate work for which they have responsibility authority, routes such as routine tasks, tasks for which the nurse does not have time, and lower priority tasks. Steps to be followed for every situation involving delegation include assessment and planning, communication, surveillance and supervision, and evaluation and feedback. Assessment and planning is the critical first step in the delegation process. Who is the best person to perform the task? Who, when you're delegating tasks or even just looking at the overall picture of your patient population, sometimes it's who is with the patient at the time is the most appropriate person, if it's within their scope of practice, or is it better because you're always balancing all the needs of all the patients. So who is the better person to perform this task? Questions to consider is that within their scope of practice, have the patient's needs been assessed? Is the task consistent with recommended criteria for delegation? Does the delegate have appropriate training, skills, knowledge to perform the task safely using current standards of practice? Are organizational policies, procedures, protocols available for the task? And is adequate supervision available? If yes, then you're going to go to the next step. The next step is communication. And I'm not going to read you all this slide, but just remember that you need to communicate clearly to whom you are delegating the task and what the expectations are. Please go take the temperature in room 103 and report back to me if it is greater than 99.5. Please help Mr. Jones up to the bathroom when he calls. Remember, he needs to use his walker when he's getting out of bed. Communicate to me. Please report back to me if he has any trouble or call me for help. You want the communication to be closed loop and that the delegate understands what they're being asked to do and report back. The next part of it is the surveillance and supervision. We need to know that the person knows how to do what's being assigned to them, the delegate, and that they're following procedures. The amount of supervision depends on the task at hand, their experience, and the patient's needs. There's a balance between too much surveillance and not enough. So you remain accessible, but you're not standing over the person while they're performing the task, because then they will think you don't trust them. Evaluation and feedback, it's the critical final element to this delegation process. The delegator compares delegates' performance against appropriate policies. And again, you're asking them to report back to you under certain conditions. You're also not directly supervising, meaning that you're allowing time for them to complete the task. If you're going to stand over them while they complete the task, you might as well do that yourself. And if there's problem areas that are identified, you need to investigate and explain any concerns. They need the opportunity to provide feedback, and the nurse needs to communicate what to do further. And remember, giving praise and recognition for job well done is important. This is the end of the second PowerPoint, and there's one more PowerPoint to come on delegation.